everyone, and welcome to another episode of Talking Public Health, a Shelby County Health Department podcast, where we take you behind the scenes of our work, highlight the people who make it happen, and have real conversations about health, community, and everything in between. My name is Tyra Moore, and I am the Special Assistant to our Division Director and Health Officer with the Shelby County Health Department.
And I'm Amaya Gray, Marketing Coordinator with the Shelby County Health Department. Today's episode focuses on mosquito control, disease prevention, and the important role vector control plays in protecting public health, especially during warmer months here in the Mid-South.
Many people think mosquitoes are simply summertime nuisance, but they can also carry dangerous diseases that impact both humans and animals.
Today's conversation will help listeners better understand how mosquito surveillance works, why prevention matters, and what residents can do to help protect themselves and their communities.
And so today we're joined by Dr. Angela Askew, a manager in vector control, and Ms. Cheryl Clausel, an entomologist with the Shelby County Health Department.
Thank you both for being here. Before we dive in, please introduce yourselves and tell us a little bit about your backgrounds and your roles within vector control.
Okay, hello, I'm Dr. Askew. I have been in environmental health for 10 years in Vector 4-5.
My name is Cheryl Clausel. I'm currently the entomologist for vector control. I studied biology in undergrad and then public health for my master's, and got into vector control completely by accident right after college, and here I am.
All right. Well, thank you. Let's get started. So first question, what role does mosquito control play in protecting community health?
So as new diseases emerge and old diseases are carried into new territory by global travel, it is often mosquito vector control that is the first to sound the alarm. So through surveillance of various vector species, we are able to be aware of the emergence and re-emergence of diseases and the expanding range of vector species. Our program specifically focuses on collecting data relating to local vectors, and that allows us to make decisions to protect public health. So through larvicide surveillance and adulticiding, we work to suppress local mosquito populations and prevent more people from getting sick.
Very cool. And so before we even continue, because I had to remember and look it up, can you explain what an entomologist is?
So an entomologist is someone who studies insects broadly, and often in vector control and mosquito control, that's the person that focuses on the mosquito biology and habitats to direct the efforts of vector control.
Okay. All right. So, yes, with y'all's vast knowledge of these little critters, why are mosquitoes considered one of the most dangerous animals in the world from a public health perspective?
So across the world, mosquitoes kill close to 1 million people annually, and a lot of that is made up by malaria cases, but there are several other diseases that also affect public health.
Okay. Cool. Well, not cool in the sense of how they impact, but cool in the sense of how we can track it and understand the impact that they make in this world.
So are there any of those diseases, particularly in the South, that they carry, the mosquitoes?
Yes, several. So West Nile, of course, is what our program focuses on.
Mm-hmm.
There's also St. Louis encephalitis, La Crosse encephalitis, Eastern equine, Western equine. Malaria is making a bit of a resurgence or reemergence in places like Florida. Mm-hmm. So several.
Yeah. And how does our mosquito control program here monitor mosquito populations and identify potential disease threats?
Okay. So we have an extensive surveillance program that monitors mosquito populations in the larval and adult stage. Our larvicide crews take samples before treating standing water, and we have traps that are set throughout the county each week. So we do 163 gravid traps and 10 New Jersey light traps weekly.
What's a New Jersey light trap? Is it like a... all these fun terminology.
It looks a bit like a green spaceship. So it's basically just a light that attracts all insects, not just mosquitoes. And then we have a pesticide inside of the trap that kills them once they're in there. There's a fan that kind of sucks them in. So it's been around for about 100 years.
Wow. Okay. Very cool.
I know you just recently mentioned West Nile virus. So why is it such a concern for public health agencies?
Yeah, so West Nile virus is a flavivirus that can be very serious for some people, and it has been around for a long time. It was discovered in the West Nile region on the African continent, hence the name. And it came to the U.S. In the early 2000s, 1999. So it's been around for a while. We're seeing, thankfully, fewer cases than when it first showed up. But it's still very serious, and it can have some pretty long-lasting, debilitating effects for people that have it.
Yeah. And so I guess when you all go into work and kind of do this work, how would you kind of take someone through the process of mosquito surveillance and testing? Like, what does that look like?
So a few different ways that we monitor the mosquito populations through the New Jersey light traps that we mentioned, and we also do gravid traps that are specifically designed to trap the mosquitoes that carry West Nile. So we have about 180 traps that we set a week, and so we collect those mosquitoes and we send them off for testing. We're also identifying species, keeping track of what species is where, the populations that we're seeing, counts. We have larvicide crews that go out and treat standing water, and so they bring back samples as well. So we're always keeping kind of a finger on the pulse of the mosquito population.
So how do weather conditions such as heavy rainfall and warm temperatures affect mosquito populations?
So water is an essential part of the mosquito life cycle. So rainfall provides the standing water needed for mosquitoes to breed. Additionally, warmer temperatures speed up the mosquito's development, leading to a more rapid emergence of adult mosquitoes.
Okay. And you all kind of touched on it a little bit, but why and how important is the source of reduction when it comes to eliminating that standing water and preventing that breeding that can happen in those areas?
So source reduction eliminates the habitat for mosquitoes to breed, since there are several species that prefer to breed in containers.
Okay. So anything that's kind of open, upright, and can collect water. And
Right. So small containers, bottle caps.
Yeah. Oh, wow. I wouldn't even have thought of that.
That's small.
Yeah.
That's small.
Yeah. It's like when you're little and you just like, your mom gives you a Hawaiian punch and you throw the top. You don't think.
Right. It collect water and it could breed mosquitoes.
Wow. Okay.
So in addition to that, like what can residents do around their homes and neighborhoods to help reduce mosquito populations?
So it is extremely important for residents to eliminate standing water around their homes. So as previously mentioned, reducing containers, flower pots, standing water, tip and toss.
Like tipping. Gotcha.
Tip and tossing water, tires hold water. So just making sure that you dump all containers.
Okay. And have you all, I guess, over the years seen mosquito seasons become more longer or more intense?
We have definitely observed that. We're also doing more surveillance for a longer period during the year now. So we're seeing mosquitoes even in 30, 40 degree weather. The adults are out. They're resting. They're not typically bothering people, but they are there.
Okay.
So yes, and also we're looking for the mosquito activity. So of course we're finding it. We're also seeing West Nile activity earlier in the year, but definitely I think the changing weather has a huge part to play in that. It's getting warmer and our cold spells are getting shorter.
Yeah. Okay. And then in the winter versus summer, is it like should we watch out for one more than the other in terms of infections?
There's definitely some seasonality with various species. The mosquito that carries West Nile is typically more active in the hotter months, so July, August. That's really peak season.
Gotcha.
So overall, what message would you all like listeners to remember about protecting themselves and their families from mosquito-borne illnesses?
So always being aware of the threat of mosquitoes and other vectors such as ticks that can, to be aware of them, to know that their effect is very serious. Avoid being outside at dawn and dusk, or wear repellents, long sleeves, long shirts, pants, things like that to protect yourself.
Okay. And I guess even with that messaging with children in particular who are a little more like free will when it comes to things, how would you say that message should go out to kids, like for parents?
So use child-safe repellent. Try to keep them covered as well. If you're sitting, use a fan to keep air flowing to deter mosquitoes.
Okay, gotcha.
So if any of our listeners or anyone wants more information to report mosquito concerns, what should they do?
They can always contact our department by 901-222-9715. We also have a vector control email, so that's vector.control@shelbycountytn.gov.
Okay, gotcha. And I guess for you all, like from working in this space for a good amount of time and knowing just what goes into vector control, is there anything else you'd like to tell our listeners about kind of mosquito season, but also just the work you do?
Well, beginning in March all the way really to September, October, not only does the mosquito season kick up, rodent season also really kicks up. Yeah. So really trying to just maintain sanitary conditions around the home, keep up with some of the outreach that takes place to kind of keep you abreast of of things to do. If there are unhealthy conditions, always report them. Like I said, we have multiple avenues. As we mentioned earlier, being safe with your attire that you wear, making sure that you stay covered.
Yeah, very good. And also just always being aware that tick-borne and mosquito-borne diseases are a very serious threat, and to take that very seriously and to look for small sources of water. It's not always the pond or the pool or the large source of water, but sometimes it can be just that child's toy that's sitting in the yard.
So true. Dr. Askew and Cheryl, thank you so much for joining us today and just helping us better understand the important work that you all are doing behind the scenes just to protect the communities of Shelby County from mosquito-borne illnesses.
This conversation is a great reminder that public health prevention often starts long before people ever get sick, and that everyone has a role to play in keeping our neighborhoods healthy and safe.
And thank you to our listeners for tuning in to another episode of Talking Public Health.
We'll see you next time.
Bye.
Thank you for tuning in to another episode of Talking Public Health. Be sure to join us for more episodes as we continue exploring the people, programs, and stories that shape public health here in Shelby County. Until next time, take care and stay healthy.